5 common myths about diabetes. Diabetes is a condition that currently affects 1 in 10 people living in the U.S. and over 420 million across the globe. What is diabetes? Diabetes is the condition in which the body does not properly process food for use as energy. The pancreas is an organ in our body that creates a hormone called insulin, which breaks down sugars, fats, and starches. When someone has diabetes, this means their body can't produce enough insulin or use it efficiently to break down carbohydrates into glucose, which is the body's main source of energy. For those with diabetes, their bodies either can't produce enough insulin or use it efficiently. Unfortunately, there are many common misconceptions about diabetes that persist despite evidence to the contrary. Let's take a look at 5 of the most common myths surrounding the disease and provide the facts to set the record straight. 1. People with diabetes can't eat sugar or sweets. False. This is probably the most common myth. Sugar does not cause diabetes, nor does it need to be cut out entirely from your diet. People with diabetes can indeed consume sugar, which is sometimes necessary to combat low blood sugar, also known as hypoglycemia. However, it's important to incorporate a well-balanced diet, which of course can include sugar in moderation. 2. People with diabetes shouldn't play sports. False. There are many famous athletes throughout history who have had diabetes, which include NFL football star Jay Cutler, MLB star Adam Duvall, and Olympic swimmer Gary Hall Jr. Physical activity can improve overall health and quality of life. In fact, exercise can actually reduce complications due to diabetes, lower blood sugar levels, and counter insulin resistance. You should consult with your doctor before starting an exercise program. 3. Diabetics always need insulin. False. People with type 1 diabetes make up about 5 to 10% of all diabetics and require insulin. If you have type 2 diabetes, you may not require insulin. According to the CDC, 27% of diabetics use insulin regularly, sometimes combined with an oral medication. 57% require an oral medication only, and the remaining 16% control their blood sugar through maintaining a healthy diet and exercise program. 4. Carbohydrates and starchy foods are off limits. False. Carbohydrates are not the enemy. However, it's important to pay attention to the type and quantity of carbohydrate consumed. Diabetics can select their carbohydrates using the glycemic index. This scale between 1 and 100 measures how quickly food causes increases in blood glucose levels. Low glycemic index foods such as steel-cut oats, whole grain bread, and low-starch vegetables such as broccoli, tomatoes, and spinach are better choices than cereals, white bread, and watermelon, which can cause harmful blood sugar spikes. Once you choose your healthy carbs, you still need to manage portions, as too many carbs can also cause higher blood sugar levels. 5. You have to be overweight to develop diabetes. False. While obesity is a major contributing factor to those with type 2 diabetes, it isn't the only reason. Genetics also plays an important role. Even with age, skinny people are susceptible to getting diabetes. In addition to being overweight, doctors recommend getting your blood sugar checked regularly after the age of 45, especially if you have any of the following risk factors: are of non-Caucasian ancestry, live a sedentary lifestyle, have a family history of diabetes or personal history of gestational diabetes, have heart disease, have polycystic ovary syndrome, have high blood pressure, cholesterol, or triglyceride levels. Talk to your doctor if you have any questions or concerns about your risk of diabetes. Thanks for watching today's video. Visit buycanadianinsulin.com to save up to 80% on brand name insulin. All insulin medication is shipped express across the United States from Canada. All packages are shipped insulated with medical-grade gel packs to ensure your insulin arrives safely.